She had an overlooked, misdiagnosed, serious thing going on with her gums and had really serious gum disease. And we're both very fortunate, and she's very fortunate.
Yes.
Welcome, Olivia, to the show.
Thank you for having me.
And we're going to be asking you about your experience. Now, you are a young person. You're 21 years old. What did you think about your oral health, your gum health? You go all the time to see your dentist, and how did you feel?
Honestly, I thought I was fine considering that I brush and floss every single day, and I just didn't see how bleeding could be a bad thing. And then after watching a couple of Nemeth shows, I realized that my gums are not supposed to bleed at all, and I made sure to make an appointment right away.
So when you obviously you've been staying on top of your, your oral health as far as you knew. You had a dentist, you went regularly, you had checkups, you saw a hygienist, and so you thought you
Hmm.
were home free and you were okay. And you were really shocked to discover that at your young age, you didn't expect to have any bacteria at all. So tell us, what was it like when you went in and sat in the chair in Dr. Nemeth's office? Because I was there and I was just as shocked as you are.
I mean, I took for granted my age considering I am 21, so I didn't think that I could get it. And then seeing all of it crawl around, it was honestly terrifying, and I started to cry because it's very scary seeing all the bacteria growing in your mouth.
So, Dr. Nemeth, tell us, how does this happen? Most young people think they're home free. They don't have to worry about anything. They floss, they drink mouthwash, they go to see their dentist. How does she become, and I saw that slide, I saw all that bacteria. How did that happen? Where did it come from? And how could it be so bad at her age?
It can be bad, fortunately, and it can start at her age. It can start younger. It can start in your teens. It can start even younger than that. But because periodontal disease or gum disease progresses very slowly, very often people aren't aware of their teeth getting loose or the teeth shifting or discomfort because it's a slowly progressive disease. And fortunately, Olivia didn't have a lot of bone loss yet. She had a lot of infection, and that infection certainly was in the process of destroying bone. But anyone can have it at no matter what age you are. The sooner you catch it, the luckier you are, and the less likely you're going to have bone loss and periodontal disease and lose your teeth from it, as well as all of the sequela that affects the whole rest of your body. The earlier you catch it, the better. And Olivia just wasn't aware of a part of it is home care. She was brushing and she was taking care of her mouth, but not properly. She really didn't know how to do it properly. And so organisms, bacteria, parasites, amoeba, spirochetes, a number of parasites and bacteria had a chance to get down under the gum. And once they get down under the gum, it's very hard just doing brushing and even with flossing to get them out completely. So we then typically will use a laser to kill these organisms and give the patient a fresh start. But it can happen. It can happen at any age. But the sooner you catch it, the better the prognosis and the better the outlook.
Well, I think with her, what happened was that she had been brushing and still bleeding and having bleeding episodes when she brushed her teeth. And unfortunately, her dentist didn't alert her to the fact that something was wrong. And she had heard you so many times on the radio talking about this, that gums should never bleed ever, ever, ever. And if they do, it's a sign that something's wrong. And so it was quite an amazing thing to watch. It was amazing to actually see all the amoeba, the spirochetes, everything crawling around in the mouth. And I know it was overwhelming for you, Olivia.
Yeah, it was overwhelming.
And what's the next step with her?
After she wiped her tears, which she did,
Right.
she was shocked, and there was a lot going on. So the next step now will be to eliminate that infection. And
So
we will eliminate the infection probably largely with a laser. The laser is extremely effective in destroying these organisms, not only destroying the organisms, but also in reducing the pockets where these organisms lie and cause infection, and also in getting the gum tissue to reattach. Some of the gum tissue is unattached because of the infection, and if we can get that gum tissue to reattach, that helps close these pockets also. So I tell the patients, and I know that Dr. Katranji the same way, that the success of the treatment is in two people's hands. It's in Dr. Katranji's and Dr. Nemeth's hands,
Right.
but there's somebody else in there. I think they're called a patient.
Right. Well, the patient
And the
also,
long-term success is going to be up to the patient. And I can do, and Dr. K can do, whatever we do. We can get that patient in perfect shape. But the disease will return if they don't know how to take care of their mouth. And even if they know how, they have to do it.
I just was so glad that I went to see it. I was glad that I went today to see the follow-up.
It was a wake-up call, was it not?
It was unbelievable. I mean, it's like you just look and you just can't believe what you're seeing. And I
Tell
think
me about it.
no, but I just think that I think that everybody should have this test done, whether they need it or not, because you don't know what you're going to find, and what's there can be cured. It can be taken away. It can be eradicated. Why not? Why take a chance on gum disease
Yeah,
that will
that's true.
progress?
And sometimes there may not be bone loss, but if you have infection, and some people are resistant to bone loss, they have a
Right.
strong bone factor, but if there's infection, it still can contribute to the systemic problems that
Right.
are caused. Even though you may not lose your teeth, you may not have bone loss. Sometimes it happens that way. But if there's bleeding, if there's organisms, these organisms get into your system and can have mild to devastating effects depending
Now, once they're
on
in, you can't
the
get them out. I
situation.
mean, that's it. Once they're in, you
Well,
can't get them out.
your body fights them off. It has a natural resistance, but they keep feeding into your bloodstream.
But why not get
Eventually,
them
they can't
before they
handle
go
it.
into the bloodstream? That's
I'm
the
sorry?
point. Why not get them before they get into the bloodstream?
Well, you can't get them before they get into the
Well,
bloodstream.
with the way you're doing,
If
you
you don't
can.
know if you don't know you have them, they're already in the bloodstream. But then you need to stop them from continuing to come in.
It's just amazing how it's just not something that's, indigenous to the Detroit area or the Michigan area. It's like all over. So I know that you have great faith in all the dentists out there that they're sending you up the flagpole, but they're not. And so people need to be aware of this. They need to be aware of what's wrong and how to fix it themselves. Look at how bad, Dr. Katranji, look at the people who are calling in. I mean, it's kind of how helpless they are. Like, well, where do I go next? How do I fix this? How do I stop it from happening? And I mean, really, Olivia was a good example because she just thought she had, the world in her hand, and it was like, nothing's wrong with me and I'm going to be okay. And then she goes there and it's like catastrophic seeing that, because young people feel as though they've got a pass.
It's kind of interesting where everybody gets their information. Usually it's like TikTok or Instagram, and it's kind of just the way things are. They're not getting the right information all the time. So
Where did you get your information from TikTok or from your dentist? Tell the truth.
Neither you.
Well, yeah,
or YouTube.
That's where you got.
Yeah, from Anne Marie.
Yeah, there you
Right.
But that's where you got the answer. But going all the years that you went to your dentist, you thought you were okay, and you weren't
Right.
okay.
Yeah, they didn't say anything.
And that's something that is a major problem.
go. So the question is will Olivia's infection be completely gone once she has the laser treatment? And the answer is yes. 100% the infection will be gone. Now, as we've been discussing, bacteria likes to repopulate if we don't take care of it. So maintaining this every 3 months with the cleaning is a way to minimize this from ever coming back and making sure that the infection is gone completely. So absolutely.
That's good news, Olivia. What do you think? I mean, you thought it was like the end of the road for you, and I kept having to reinforce the fact that once you go, it is gone, and you follow the doctor's advice going into the future, and you'll be fine.
Right.
And thank God she had no bone loss, right?
There is a little bit of bone loss.
But not a lot.
A little bit in the lower end.
But she's
lower
not
end front.
losing any teeth over it.
No, I don't think teeth are a little bit loose, not too bad, and she's not going to lose those teeth as long as she adheres to the regimen at home, which isn't a difficult regimen, but it's just something that you need to do, and you got to make sure you do it right, and that's what we teach her.
So the bottom line is, even at 21 years old, you can be in this kind of a serious condition and not know that you're in this condition. So again, I know
Absolutely.
that I always have to say this. Everyone should go and get that test, that screening. Absolutely everyone. You
You
have nothing to lose. We have another quick caller here if we've got time. Alice from Shelby. Alice, what is your question?
Hi, I am calling just to congratulate Olivia and congratulate you too, Anne Marie, for both facing your fears and confronting this disease head on. I can assure you it's probably terrifying for the common folk, and doctors can lose sight of that. And I just wanted to congratulate you both.
Thank you.
Well, thank you very much. Very kind of you. But once again, like I said, you've got to be your own advocate. I know I'm the patient advocate, and I say go out there, get the test. Wonderful if you walk out and you have nothing, but if you've got anything on that screen, I want it gone.